In a fragile world, more than 1 billion people alive today have seen their lives upended by crisis, conflict, instability, epidemics, and natural disasters have driven millions from their homes. The lack of a functioning judicial system, the breakdown of public administration, the destabilization of the traditional protection structures, family, communities, and the precarious nature of livelihoods leave women and children exposed to all sorts of exploitation, abuse, and sexual violence. Shanty structures, limited access to water and proper sanitation, lighting, and poor security are among the growing list of challenges that continue to make lives of those living in camps vulnerable and expose them to all forms of violence. At the level of social and health structures, there is no appropriate response to these problems. Only few agencies ensure an effective response to cases of sexual violence. Access to antiretroviral therapy and post-exposure prophylaxis (PEP) drugs is equally limited. Even as the conditions deteriorate, proper humanitarian assistance programs can help restore human dignity, meet their needs, and ensure their rights. In partnership with IOM, NoFYL strives to contribute to the reduction of physical and mental health consequences among women and girls who are victims of sexual and gender-based violence in Mogadishu and Afgoye, Somalia. Through community outreach and awareness campaigns, NoFYL empowers the community and victims of GBV to challenge the existing systems which uphold inequality that causes their impoverishment, demand their entitlements, and work in collaboration with concerned stakeholders to this end. Other strategic focus is service provisions in medical, psychosocial support, and referral to legal services and livelihood support programs. Our nurses ensure quality and confidential access to medical support is provided and referrals made through ambulance services when needed. Our counselors use survivor-centered approaches to ensure quality of care and support is provided to survivors in the recovery and healing process. In consultation with CMR Task Force, we successfully conducted clinical management of rape training for participants from different organizations in Mogadishu and Afgooye. The objective of the training was to educate health service providers on GBV, confidentiality, improving clinical care, and how to competently respond to the health and psychosocial needs of sexual assault survivors, and importantly, to ensure correct treatment of GBV cases such as post-exposure prophylaxis administration for rape survivors. NoFYL has successfully trained community dialogue facilitators to build their capacity for facilitation of dialogue around GBV and HIV in their respective districts and to support victims in their communities. These sessions are designed to recruit teams that champion change, following up discussions to the end, where reviews are frequently made to measure change in attitude beliefs from negative to positive.
We were
8 persons who were the committee of this IDP camp. We were trained by NoFYL. At the start of the training, we were really shy and surprised to talk about GBV. From the training, we returned to the IDPs to share through dialogues. They were all surprised the same way we were at first. There's a lot of silence around violence, and HIV is not a topic of discussion. There is a better understanding. There's a huge change among the IDPs now, despite being the first time we are discussing such issues in our community. Today, Members are talking about every issue relating to GBV. They are exchanging ideas. For instance, if a woman is raped, they used to hide the incident, but now incidents are identified more and survivors are sent for medical support for treatment.
After 4 months of discussions, a lot of improvement was noted, although more time is needed to have more impact. To address the poor lighting conditions in IDPs camps, solar lanterns were distributed. Where the most vulnerable were selected as beneficiaries, they were enlightened on the importance of the lanterns and how to use them.
This solar lantern is a very useful item for us, especially our children who use it for reading. Our houses were dark before, but now we are out of darkness. Even the armed men cannot dare enter our house.
Our interventions have improved the living standards and the level of decision making of pastoral youth and women.